Oh, good afternoon. Thank you all for being here today for actually a unique opportunity here for our weekly COVID-19 briefing. I can't tell you how happy I am to see you all in person for the first time, I think, since we've been doing these briefings over the last year or so. Today, I'm joined by our Commissioner of Public Health, as we usually are, Dr. Mike Mendoza. We're also joined today by Dr. Nana Bennett from the Finger Lakes Vaccine Hub and the Finger Lakes Vaccine Task Force. We're also joined today by John Erlob, the owner of Roarbox Brewery, Leslie DeCesar from the Irondequoit Beer Company, and Malcolm Franklin from the Genesee Brewery. I want to give a really big thank you right now to the Erlob family for opening up the Roarbox Railroad Street Brewery today for our exciting announcement. Roarbox is more than just the first craft brewery here in Monroe County. It opened more than 25 years ago on Gregory Street, and it's an amazing example of the power of perseverance of our local small businesses and their commitment to helping our community, especially as we work together to fight the COVID-19 pandemic. It also happens to be the site of one of my first jobs when I was growing up. So John was one of my first bosses. It was good, right? No, it went well. I went well. So, at the start of our vaccination efforts, demand for the vaccine was incredibly high, as you all know. We needed large distribution pods like we had at the convention center, the county fleet center, to meet the demand that we had of all our residents who wanted to be vaccinated as quickly as possible. But as we get through the vaccination process, we're getting to the point where obviously it's more available, and we're now finding better ways and more ways to bring it closer to where people are and closer to where people want to be. We've had a lot of success with this effort. We did pop-up events that we call them pop-up events. We've done them with the Red Wings at Frontier Field. We just completed 3 really great weekends of clinics at the Lilac Festival. Over 70 people came to the Frederick Douglass Greater Rochester International Airport earlier this week to get their vaccine. We've also had new fun opportunities have presented themselves over the last several weeks, which would not have been possible without so many great community partners. We had musicians from the Rochester Philharmonic Orchestra are playing at the convention center right now, today, and over the last weekend. We even had zoo animals at the convention center as well. To just bring a little fun to the process and help give some people something to do while they wait for their vaccination. They're just different approaches that we have to making the experience more enjoyable, easier, and make it maybe a little more inviting to folks who might be hesitant to getting the vaccine. It also underscores, though, that throughout this entire process, and this goes back to the very first day of the pandemic, nobody does any of this alone. The whole process of vaccinating this community, of protecting and keeping this community safe, has been a real team effort from every corner of this county, and it's bringing people together who never thought they'd bring together. Right? Who would have thought zoo animals and vaccinators would be in the same space, right? We have the RPO in a medical facility while people are receiving vaccination. And I'm standing right now about to talk to you about vaccines in a brewery. And what a greater sense of community and a greater way to display how we are and strong we are as a community. So today, we're here to announce yet another incredible partnership, and this one is between our local breweries in Monroe County. Today, we're announcing the Choose Your Brew initiative. Monroe County is going to be hosting a series of pop-up COVID-19 vaccine clinics at participating breweries throughout the month of June. Anyone who gets their vaccine at one of these brewery pop-ups will get a free drink or a voucher for a free drink, depending on the hours of operation of the clinic and the brewery hours. Now, I'm telling you, this isn't just a great way to go out and receive your vaccination. It's also a great way to get back out and see what our fantastic local breweries have to offer. Our small businesses have suffered so much during the pandemic, and this is a great way to get reacquainted with our local breweries, to get the life-saving vaccine, and also maybe have a little fun while we do it. We have great products here. I think the local craft brew scene here in Rochester is second to none across the country. They serve a great product. They're a great piece of the local economy. And yes, even people like me before, but also a lot of folks working in these breweries, they also bring a lot of jobs to our area. I'm so grateful for Roarbox Brewing Company, the Genesee Brew House, the Irondequoit Beer Company, Lock 32 Brewing Company, and the Three Heads Brewing for their collaboration on this effort. These pop-up clinics will be held at the Genesee Brew House, at 25 Cataract Street on June 8th. The Roarbox Brewing Company out on Buffalo Road in Ogden on June 10th. The Irondequoit Beer Company at 765 Titus Avenue in Irondequoit on June 15th. Lock 32 Brewing Company on 10 Schoen Place in Pittsford on June 19th. And at Three Heads Brewing on Atlantic Avenue in Rochester on June 21st. We all know that the more people we get vaccinated, the closer we're going to get to returning to that sense of normalcy, going back to freely going about doing the things that we all know and we all love, being part of this great community. And I've lost my next page. So this part I'm just going to have to wing. In addition to the Choose Your Brew, because it is a Choose Your Brew, in addition to the breweries who have partnered with us to open up their breweries for these pop-up clinics, we are also working in partnership with Dunkin' Donuts. So you get to choose your brew, and this is how it's going to work. In the month of June, if you attend any one of those pop-up clinics that we're having at the local breweries, you'll receive a free drink or a free coupon for a drink. And if you go to any of the other county-run facilities starting on June 1st, the first 2,000 people to come will receive a free $5 gift card to Dunkin' Donuts. So you can truly choose your brew and where you want to go. And we want to thank Dunkin' Donuts for donating those gift cards to the county to be able to use for this effort, to make sure that no matter which way you want to choose to go here, there's a little bit of fun, a little something to give back in a way that you can support some of our small businesses that are calling Monroe County home. So we're so grateful again to support these efforts. I also want to tell you, as part of just the COVID briefing today, before we bring the other speakers up, our numbers here are really headed in the right direction. And I want to thank the community for all of their work and support to getting us where we are today. As the vaccination numbers continue to increase, our number of positive cases is heading down, and it's heading in the right direction. We are announcing today for the 4th day in a row our new positive cases are below 100 cases. That is a significant milestone for us. The 7-day average, rolling average, has been decreasing steadily over the last several cases. And so while our positivity rate may still be maybe comparatively higher to other regions across the state, if we put it in perspective to where we were 2 months ago, 3 months ago, 4 months ago, we're actually in really great shape as a community. I feel very good about the direction we're heading in. I'm just so delighted to see us all being able to be out here again together, doing a briefing together in person, and it's because we've been able to make such progress in fighting this pandemic and getting to where we are today. So with that, I'm going to turn it over, as I usually do, to Dr. Michael Mendoza.
Thank you, County Executive Bello, and thank you to all of you who've joined us here today. It is really great to see so many familiar faces. As we have done several times since the beginning of the COVID-19 pandemic, we are once again entering a new phase. We are adapting to new guidance and changing our behavior to reflect the fact that we are finally beating this virus. As we have said all along, effective vaccines are the most powerful weapon that we can arm ourselves with, and we have done just that. For the 4th day in a row, as you heard, we are going to be reporting fewer than 100 new cases of COVID-19 here in Monroe County, and though there may be occasional upticks from now on out, we are definitely seeing this turning in the right direction. Since the beginning of March, 98% of the positive cases that we interviewed here in Monroe County report that they did not get vaccinated, which means that our breakthrough rate here in Monroe County is 2%, which is actually less than the national average. So we know that these vaccines work. And that means masks off for many of us. It means new rules for public spaces and backyards. It means we can talk about fully reopening our schools in the fall. Through all of this, though all of this is cause for celebration, it is also a very confusing time for many. So I want to take a few moments here today just to clarify the most important things that we need to come away with. First, it's to get vaccinated as soon as you are eligible. If you are not eligible, it is very important that you still wear a mask in public spaces to protect yourself and others who are not vaccinated. This is especially true indoors. The virus and its variants are still here, and people are still getting sick. And unfortunately, we still continue to lose members of our community to this pandemic. If you are vaccinated and choose to wear a mask, that is perfectly okay too. There are some with medical reasons to wear a mask right now, and we know that many people are still trying to come to that new sense of normal and don't yet feel comfortable taking their mask off, and that is perfectly okay as well. We also know that it is important sometimes for vaccinated parents to role model wearing a mask for their unvaccinated children. We know that some people are just more comfortable wearing one right now, and that's also perfectly okay. So most importantly, let's not judge one another. Let's continue to work together, as we have all along throughout this entire pandemic, so that we can help our loved ones and our entire community to remain safe. So with that, I'm going to hand it over to Dr. Nancy Bennett, who will give us an update on how we're doing as a community with regard to the vaccine effort.
Thank you very much, Dr. Mendoza, and hello to all of you. It is incredible to be here in person. It's been a Zoom world for far too long, and it's just great to see you all. I'm a little nervous because I haven't been out in public, but it's great. It's great. You know, when Adam and Mike asked me to join the vaccination effort back in December, I knew it was going to take a village. And then when we added on all of our surrounding counties, so our full Finger Lakes region, we imagined that it would be all of us. It would be everyone in this region coming together to do this effort. And that's indeed what has happened. And it turned out that my job from Monroe County was somewhat limited because they are so terrific. However, the coordination across the whole region has been an incredible experience. And I just wanted to reflect on that for 1 minute before I talk about statistics, which are a little dull. That experience of working with all of our surrounding counties and really coming together as a region is something I've never seen before in my public health career. It was truly remarkable. And I think, as County Executive Bello said, we started out with not enough vaccine and too much demand, and we all struggled to try to help people from one end of our region to the other end of our region get a shot in their arm. And now it's gotten a little more difficult because we see that we haven't gotten as far as we would have liked to have gotten. But what's happening now is even more creative and even more exciting. So initiatives like we're kicking off today are just an example of the huge creativity of our region. And not only in Monroe County, but in all of the surrounding counties, the same kinds of activities are going on. And I'm confident that if we just keep doing this and we just keep working at it, we will get our vaccine into every arm, and we will end this pandemic in our region. So it's been an incredible joy to be part of this whole effort. And you know, it's mind-boggling that we've gotten as far as we have. So at this point in the region, we've given first doses to almost 60% of those over the age of 12. We've given full, both doses, to almost 50% of those over the age of 12. So we've made huge progress since December. And it's slower now, but it's happening. And the creativity of our region, I think, will carry us over the finish line. So we thank you all also, because throughout this entire effort, the work of the media has been tremendously important in sharing the message, in giving people the critical information they needed, and in really helping us to vaccinate our region. So it takes a village, or maybe many villages, and we thank you for your efforts. Thanks. And back to us.
Nice job. All right, thank you, Dr. Bennett. Thank you, Dr. Mendoza. And then next up, I'd like to invite John Erlob, the founder and owner of Roarbox Brewery, who's hosting us here today and is hosting one of the pop-up clinics that we'll see coming up in the month of June.
Well, welcome to Roarbox, everyone. Thanks for being here today. This is kind of exciting. It's exciting for us too. Our industry as a whole, as I'm sure most of you know, whether it's the restaurant industry or craft beverage industry, we've gone through some very dark days. It's been very difficult, but we really are coming out of this. And I want to thank all the county executives, or the county executive and the commissioner and Dr. Bennett for all the work that they've done, because I can tell you already we have really turned the corner. We're starting to get busy at Roarbox As you can see, a lot of our guests don't have masks on also. So we've really, really come back a long ways. We also know that we're not all the way there. And we're excited to be part of this program. I think it's going to be great. Really what it does, I think a lot of our tasting rooms and breweries are in neighborhoods. And we're going to the neighborhood. And I think many people come into Roarbox on a regular basis and a lot of these establishments, and they can make it very easy to get vaccinated. All you have to do is stop in. You can plan to have lunch if you'd like to, stop back another time, but we're excited about this, and we really do hope that we can get the word out to everyone. And if it hasn't been convenient, please stop in. Let's keep this process moving forward. We've come a long way, but I think we can do even more. So again, thank you for being here, and we're looking forward to this event and these vaccines.
Thank you, John. And with that, we could take any on-topic questions anyone has for any of the speakers today.
Yeah, I have a question in regards to like reflection. Memorial Day weekend is the perfect time to do something like this for this type of weekend, barbecues. But also, I just wanted to reflect on this time last year, we were doing gatherings of up to 10 people at the most. So can you just reflect on how far we've come from last Memorial Day weekend to now?
Yeah, from my perspective, I think we look a lot different this year than we did a year ago. I remember Memorial Day last year, and I participated in a remembrance event on Memorial Day where we were seated, I think, at least 10 or 15 feet apart with masks on and no audience. It was all done virtually with people watching from home. And that's hard, especially when we're built as a community to be together and to celebrate together. We mourn together, and we want to have fun and be a family together. And I think over the last year we've sacrificed a lot of that. And as we come out of this now, particularly just in the last couple of weeks here where we've been able to lose the mask when you're vaccinated, I think we can all take a deep breath. We can be proud of the efforts that we've done. We can I think take a few moments to understand the sacrifice and loss that many people in the community have had. But I think we can also understand that it's safe again to be together and be outside, and particularly when we're outside. And so on this Memorial Day, I'm going to gather with communities across Monroe County. I'll be in a parade this weekend. I'll be at a celebration this weekend to pay my respects for the men and women who gave their lives for this country in an appropriate way in person. I'd encourage others to do the same. And I'm looking forward to the 4th of July like everybody else is, the end of the school year. I know my kids couldn't be more excited. And to get back to some of these festivals. Even the Fairport Canal Days is coming up. And I think there is that desire to do that. I was at opening day at Frontier Field. And in some ways, it almost didn't matter that the baseball team was playing. People just wanted to be back at Frontier Field and be around everybody again. And it was just exciting and almost an emotional moment for us as a community to have come through this and get to the other side. And I have every confidence in the world we're going to come out of this a much stronger place than this pandemic found us.
And with all the incentives being given now, beginning people were early adopters, they may have been afraid to get the vaccine.
Yeah.
What does it say now that you're incentivizing, bribing, coaching people to come get a vaccine? What does it say to the early adopters who went through a whole lot to get this vaccine with no reward other than they were trying to take care of themselves or their families?
Yeah, I mean, everyone's going to have a different level of comfort with the vaccine. Also, as you go through this, there wasn't always universal eligibility for the vaccine. If you remember when it started, it was really just started with folks in nursing homes and in hospital settings, and then as more vaccine becomes available, more people are eligible. And now we're at that point where the supply of the vaccine has outstripped the demand, and we're working with people who are more hesitant. We're also working with people where this may just not be a priority for them, so that's why but they're still willing to take it. And we're finding those people every day. There's still thousands of people in our region who are getting vaccinated every day. It's just more you have to be where they are. Announcements like this today, choose your brew. It's a free beer or a $5 gift card to Dunkin' Donuts. This is just a way to have fun, a little bit of fun with it. And then also, the breweries really stepped up and wanted to be part of this and bring people back to the brewery, show that it's safe. Come on back and have a drink. But we also were delighted Dunkin' Donuts stepped up so that we could choose. Not everybody wants to go have a beer, but we can go get a cup of coffee. If you're a kid, a 12-year-old who's getting vaccinated, here's a gift card. Go get a donut. So it's just a way to have fun with it. Same thing with the zoo. Let's have some fun while kids are waiting and people are waiting to get a vaccine and the RPO's entertaining folks.
The COVID tracker for the vaccine still shows lots of lag in African American and Latino communities. It was 9.4% of people vaccinated and 6.7 respectively. Is there anything being done in particular communities where, again, things have been lagging for a while?
Yeah. Do you want to take that? Oh yeah, Dr. Bennett will take that one. Yeah, sure.
Thanks. So thank you for that question, Patty. There is one problem with those data, and I have to point this out every time we talk about it. I think it's highly likely that people of color are lagging with respect to their vaccine rates, but those data have so many unknown people in the database that they're not fully accurate. So many people who get vaccinated, we don't know their race or their ethnicity. And so as a result, it's a large enough percentage that it would skew any of those percents in any direction, and we just don't know the answer. But putting that aside, I just have to always say that because it's important people understand the data aren't perfect. But putting that aside, we have been targeted on the African American, Latinx, and other underserved communities from the very beginning of the vaccination efforts. The task force has really focused in on that as a primary issue from day one. Our first value in this entire vaccination effort was equity. Equity, transparency, and efficiency. That's what we were going for. So the equity part has been there from day one. And as a result, we've had many clinics in inner city locations, also in city locations in our region, because not all of the underserved communities are in Monroe County. Some of them are in some of the other counties. And so we've had pop-up clinics, we've had more standing clinics. The convention center was chosen initially because it was downtown. There's been a lot of focus on helping people. The Hawkeye Center was there for just until this week. And actually, Hawkeye is going to continue as a state site, smaller, but still there in the neighborhood. The 4 quadrant sites were really a critical effort, and they are continuing as well. So there have been huge efforts to increase accessibility. The flip side is demand. We got to have demand. You can't just build it and they will come. And as a result, there have been huge efforts through Common Ground Health to do outreach into these communities, to do education, to have heart-to-heart conversations with people, to really identify what the barriers are. And what we hear from many people is they just want to hear about this vaccine from someone they trust. And that means someone in their community or their doctor. And so now our efforts are very focused also on accessibility through doctors' offices, in community-based organizations, and really getting people to be advocates and ambassadors for the vaccine, asking people to talk in their social settings with people they know and really share their knowledge about the safety and effectiveness of the vaccine.
Is there a percentage of the population that you're going to stop with the incentives as far as like what percentage of the population would you like to be vaccinated for the county to say, okay, we're set, we're okay now?
Well, we aimed for...
We're going for 100%.
Yeah, well, frankly, no. When we first started out, we basically said 70 to 80%. Our official goal was 70% of the entire population. So we have a ways to go.
As we head into the summer months, I don't know if this is maybe a question for Dr. Mendoza, we head into the summer months and the announcements of these incentive programs. Do you find so far that they are working? Could we see more of these past June? Are we at the finish line?
No, I don't think we're at the finish line. In high school, I used to run the quarter mile, and it's one of those races that you can't really sprint, but you can't treat it like a long-distance race. So you just have to keep running as hard as you can, and I think that's where we are. We have incentives now that seem to be working now. We have experience and anecdotes from other regions, and we have every reason to think it will be helpful here. But when we turn the page, I think we'll be open to new approaches and new ways of looking at it, just as we have throughout this entire 6-month period. So from my standpoint, we're not done until we're at the finish line, and we're not quite there yet.
Dr. Mendoza, I have here in my refrigerator and everything in moderation, but is there an idea of using alcohol to promote public health?
Well, this is, again, just a way to have fun. There are certainly people who consume alcohol responsibly, and I think this weekend is a good example of that. Many people will consume alcohol responsibly, but this is really a small token of how we get people out into the community and have a little bit of fun. And certainly if people choose to have coffee or caffeine or a donut, everybody has to choose their vice to some degree, but we're encouraging everything in moderation. The real goal here is to get people out and to get the vaccine in their arm.
Can someone touch on just the milestone of even today? Here we are in person, and how exciting that is to not be doing a briefing over Zoom.
Well, from my perspective, it's a bittersweet moment. I look back at all of the things that we've gone through as a community. I remember our early press conferences at the public safety training facility on Scottsville Road, and many of you were there with us, looking ahead at a vast unknown. And now we can look back and reflect on all of the things that we've learned, pay respects to all of the people that we've lost. And I think we have to now turn a page and do the really hard work of rebuilding. And I think mental health is going to be one of those areas that we will have to rebuild. And if there's anything that good that comes out of this pandemic, it's the recognition that mental health has been overlooked for far too long. And I think as we recognize the trauma that this pandemic has inflicted on students, families, communities all across this county, I think we need to redouble our efforts to commit ourselves to having mental health accessible at all levels of our community, having mental health available in primary care medical sites, integrating medical care and mental health, and paying attention to the addiction crisis. The overdose crisis has not gone anywhere. And you all remember me talking about this at great length some months ago, and it has been overshadowed by the pandemic, but not in any other way. We have been working on this diligently, and we need to go back to that and really see an end to that epidemic as well.
With an event like this, or with a series of events like this, who is the target audience? And then how do you make sure that you're dreaming up other events that will target some of the the black and brown communities that are still lagging behind in these vaccination numbers?
So,
and not to interrupt Will, but I think it would be a part of this question. Is education level, is it also a class issue, and how do you target that in conjunction with that?
So let me start here with the target audience for events like this. I mean, what we have found is working, and I know this kind of goes off a question I know Patty asked just a few minutes ago too about bribing people or something like that, or offering incentives to this. Now, what we're doing here, what we've found has worked, isn't offering large incentives to be able to get people to come in and get a vaccine. What works is meeting people where they are. That's why at the beginning stages of this, being in the hospital facilities, being at the convention center, the Fleet Center, Hawkeye site, that was appropriate. That we needed large venues to get large groups of people who really wanted the vaccine, needed the vaccine for work, to get the vaccine as quickly as possible. Then what we moved on to is working with rec centers. We're working with schools. We're working with community organizations to get closer to where people live, right? So we started getting out into the community, get closer to where they are. Then as the age started going down, we started working with schools. So when it started with the 17-year-olds, right, and up, right? When they became eligible to get the vaccination, we started working with schools so that we can get into the school buildings, be part of the school community. Again, this is where families are, where they're comfortable going. Families are comfortable being in their school buildings to bring it closer, and that was met with great success. We worked with fire departments because people trust their fire departments. They're used to working with their fire departments. And now we're moving into the business community, right? The breweries stepped up. They want to meet us where they are. So we're meeting them now at local breweries. We're meeting them at the airport. We're meeting them at the transit center. Trillium did a fantastic job working with RTS this week. The YMCAs were in there working with families. Again, as the age continues to go down as to who's eligible, we need to be right there where they are. So that's what this is really all about. And frankly, that's what we found success with here in Monroe County. You can look at other parts of the state, but we're beating the state average right now in our vaccination rates, and we're running well ahead of them. And the reason reason why is I think because we took that approach too of, first of all, I have a great team standing here behind me of doctors and community leaders all across the county who are educating people, talking about the vaccine and the efficacy of it. But we also are doing a really good job of being thoughtful about how to be where people are. So that's a big piece of it. I don't know if you got anything else to add.
I'll simply add that the vaccine program is, in the last 6 months, has really been an exercise in humility. We don't exactly know who's going to come. We target everybody who will. But at every time we think we know who's coming, we're surprised. Earlier this week, we had a pod at the airport, and we were just assuming that airports are where people travel. And we were expecting to get a large number of travelers, either coming or going. And it turns out that the vast majority of people who got their vaccine at the airport were people who worked at the airport. We were surprised, pleasantly so. We're going to go back to the airport and see if we can do more. So many examples of just having the humility of listening to our community and responding to the feedback, because I think that's honestly what's gotten us to where we are.
So how many people would you need to schedule something? I'm thinking of the skate park, I'm thinking of the International Plaza, places like that. I mean, what do you start with? We're going to assume that 50 people are going to show up, 200 people are going to show up, and then put it, if you really want to go where people are, and maybe you're getting a tough time to get that younger audience, places like the skate park, or again, for the Latin community, is North Clinton Avenue setting something up on the corridor there and some of the restaurants there. How do you determine where you're going to put these?
The beauty of this effort is that there's no reason you can't come back. And so many of our approaches have been really pilot settings. We'll dip our toe in the water. I talked to my team earlier this week, and I said, if you've got 2 or 3 people at a business, reach out to them, and if we can send 1 or 2 people just to take care of that real fast, we'll do it. We have to limit ourselves. We've got a limited number of staff, but no group is too small. We'll do the best that we can. And certainly, if we're going to deploy a large group of people, we're going to hope to have a large number of people coming. But at this point, we're open to feedback, and we want to hear from the community as to what would work for them, and then we'll put our heads together and see if we can come up with a solution.
Just one additional comment on that, Patty. We do have 2 work groups that have been in place for a long time. One really focused on the urban inner city community, and one focused on the rural community. And they look at the data. So we have data by zip code of vaccination rates in our region. If you go to flvaccinehub.org, there's this beautiful interactive map you can get a huge amount of information from. And so those 2 groups, who are composed of a number of people from our community-based organizations, they look at those data and they make a list of places they think we need to go. And they have been really instrumental in scheduling many pop-up clinics, also in advising the county about where to put the 4 quadrant sites. It's really been critical to have those data and to use those data.
Very good. All right, thank you, everybody. Thank you all for coming today. Yep, thank you. Thank you, guys.
I'm glad you made that call.
Yeah.
It's awesome. We got to see we're going to get people out.
Thanks so much.